got it. Okay, so now all questions have completed. I want you all to please click the photographs of your answer sheets and send on our WhatsApp group within the next 30 seconds. We've got 11 answer photographs. 12.
Sir, excuse me, sir.
Yes.
Sir, one girl is not a part of the group. She wanted to be a part of the. Acha, she sent it.
Those who are not, yes, those who are not on group cannot message their answer sheet on that group, can message to either me or Dr. Surinder. Do you have
Yes, sir.
our
Sir.
number?
So one girl, Harshita, I guess she has sent it to you.
All right, it's okay.
Yes, sir.
So all are done, Surinder?
I've got 11 answers on the group.
11 and one with me.
That is 12. So 13, 14, and 15. Yes. So we just had 12 participants. Yes. So we've got all the answers.
So we can show the answers to them, Surinder?
Yes.
Okay. Surinder, we can also add small explanation with these questions and answers.
Yes, sir. So the first question was that which of the following all are acyanotic except. So Epstein anomaly is a cyanotic heart disease. It is associated with right to left shunting of the blood. The next question was all of these symptoms are common signs of toxicity of ingestion with both anticholinergic and sympathomimetic agents, except so altered mental status is seen in both, hyperthermia and mydriasis are seen in both, but in sympathomimetic we have wet skin, and in anticholinergics we have dry skin. Current jelly stools are typically seen in, this is a common question, this is seen in intussusception. Then all of the following are false regarding roseola infantum, except. So we have to find which is the true statement. So the true statement is that it is caused by HHV6, it is also caused by HHV8. Caused by parvovirus B19, slapped cheek appearance, and the rash lasting for 3 weeks. That is erythema infectiosum. That is not roseola infantum. B, C, and D are characteristics of erythema infectiosum. Then, which of the following is an example of a deformation? spina bifida is the deformation. Then which of the following methods will not be helpful in removing potassium from the body in hyperkalemia? Sodium polystyrene sulfonate helps us in removing potassium. Similarly, furosemide, dialysis, and CRRT. But sodium bicarbonate will help us to improve the acidosis, and that will only shift the potassium. It will not remove the potassium from the body. It is only involved in the intracellular shifting. Which of the following vaccines must be avoided in immunodeficient patients until completion of the immune workup? Hepatitis B, tetanus, rotavirus, and pertussis. So here the live vaccine, which is rotavirus, that live vaccine has to be avoided in immunodeficient patients. Which is seen in children predominantly fed on goat's milk? Goat's milk is characteristically deficient in folate. It has higher levels of vitamin D, calcium than cow's milk, and vitamin K is also present in more or less similar amounts. But folate, only 20% of what is present in cow's milk is seen in goat's milk. So children who are predominantly fed with goat's milk are more likely to have folate deficiency. Women who are predominantly given goat's milk are more likely to have children with neural tube defects. So according to the neonatal resuscitation program, all of the following are initial steps of newborn care except. So in initial steps, we have drying, we have stimulation, we have clearing of the airway if required, we have provision of warmth. But using LMA, if the baby is not crying vigorously, is not part of the initial steps.
Excuse me, sir.
Excuse me, sir.
Yes.
Sir, in the PPT that you've shown, laryngeal mask was the D option, not the B one.
Yes, sir.
Okay.
Yes, sir.
Yes,
It was
sorry.
D option.
Okay, yes, sorry. I'm sorry for that. In this, when I was compiling all these questions in single slide, that has gone wrong. Yes, this was the D option. I know that. Okay, I'll check accordingly. Question number 9. The correct answer is the D option. Okay. Then question 10. All of the following urea cycle defects have autosomal recessive inheritance except. So OTC deficiency, ornithine transcarbamylase deficiency. This is the X-linked deficiency. All the others are the autosomal recessive defects. Then using the holiday cigar method of maintenance fluid calculation, what will be the volume of maintenance fluid per day needed for 5-year-old children, for a 5-year-old child weighing 18 kgs. So by the holiday and cigar method, we calculate 100 ml per kg for the first 10 kgs, then 50 ml per kg for the next 10 kgs. So since this is an 18 kg child, for the first 10 kgs, we calculate 1000 ml, and then for the next 8 kgs, we calculate 400 ml. So the total would be 1400 ml per day. All of the following are true about the WHO diagnostic criteria for SAM. Weight for length should be less than -3 standard deviations. Mid upper arm circumference should be less than 115 mm. There should be presence of bilateral pitting edema. The age group is 6 months to 59 months or 5 years, not 6 years. Okay, 59 completed months, 6 months to 59 completed months. So A is the answer. All of the following are congenital causes of pancytopenia except, well, dyskeratosis congenita, Pearson's, and Fanconi's are congenital causes, whereas Evans syndrome is an acquired cause. So Evans syndrome is the answer here. All of the following are used in the management of nephrotic except cyclosporine we use, tacrolimus we use, rituximab we use. Adalimumab is a monoclonal antibody that is used in asthma, not in nephrotic. All of the following are mixed sensory and motor cranial nerves except, this was a simple question, the answer is vestibulocochlear, which is the only sensory nerve. The others were the mixed sensory and motor nerves. Then a child presents to you with focal seizures. CT scan shows multiple ring enhancing lesions. All may be the likely diagnosis except in neurocysticercosis, tuberculoma, and pyogenic brain abscess. These are common differentials for multiple ring enhancing lesions. In tuberous sclerosis, we primarily do not have ring enhancing lesions. We have multiple tubers and white matter changes. An 18-month-old male presents to your clinic with a history of chronic diarrhea, poor weight gain, alopecia, severe rash on his extremities and face. What deficiency must you consider? The answer is zinc. Zinc deficiency may present with chronic diarrhea, rash, alopecia, and poor weight gain. Okay, regarding the development of a baby, all of the following are false except, so we had to find the true statement. A baby can drink from a cup at 8 months of age. That is false. We usually develop it by 12 months. Baby babbles at 4 months of age. Again, this is wrong. Baby says 3 to 6 words at 15 months of age is the correct answer. Moro's reflex persists. Usually Moro's also persists only up to 2 to 4 months.
Thank you, sir.
A lady brings her 2-year-old male child to you with complaints of loose stools for 12 days, no blood, no mucus. At presentation, child has sunken eyes and skin pinch goes back slowly.
And bubbling started.
In what group will you classify the patient according to IMNCI? So since eyes are sunken and the skin pinch is going back slowly, only these two signs are present. So this becomes some dehydration. This is not, there is no additional feature to suggest of severe dehydration. In severe dehydration, skin pinch will go back very slowly. The child will be lethargic. We have not mentioned such features here. Then persistent diarrhea, for the child to have persistent diarrhea, the duration should be 14 days, more than 14 days. So this is 12 days. So the answer is some dehydration. Hypokalemia is seen in all except it is seen in Barter's, diarrhea, and in hypomagnesemia. In aldosterone resistance, we have characteristically hyperkalemia, not hypokalemia. Okay.
Sir, I have a doubt in question number 16.
Okay.
So the question says CT scan shows multiple ring enhancing lesions, but does a neurocysticercosis present with solitary lesion?
No, neurocysticercosis can have multiple lesions also, multiple ring enhancing lesions also. We have multiple neurocysticercosis also.
Ishika, you must have heard of starry sky appearance.
Yes, sir.
That is multiple neurocysticercosis, multiple small ring enhancing lesions, right? That is starry sky appearance, which is seen in neurocysticercosis, right?
Okay, thank you, sir.
Excuse me, sir.
Yes.
Sir, in question number 18, regarding the development of a baby, all of the following are false except, sir, babbling starts at 4 months of age. So, sir,
4 months is slightly lesser for babbling. Babbling would usually be 5 to 6 months.
but sir, babbling can start at 4 months of age, sir. It is not mentioned if the matlab, this can also be the correct answer. That is what I'm saying.
Well, we try to find the best fitting answer. So that would surely be 3 to 6 words by 15 months. Hai na? Baki,
Okay,
yes, development always has a range. The issue with having questions with development in an MCQ is that there are always ranges for development. So
Okay.
yes, it may start, but in majority of the children, babbling would appear later.
Okay, sir.
If you go through your standard books, right?
Yeah.
So in that, babbling is mentioned that it starts at age of 6 months.
Yes.
Okay, sir.
Yes. Babbling starts at age of 6 months. It's mentioned in your standard
By
book.
4 months we have cooing. Cooing occurs at 4 months, and by 6 months we have babbling.
Sir, according to what I read, sir, cooing occurs at 2 to 3 months, and babbling starts at 4 months. But all right.
Oh, you are right. You are right. Earliest cooing can start at age of 2 months, and earliest babbling can start at age of 4 months. But usually, normally, on an average population, average age of children, babbling develops at 6 months, right?
Okay, sir.
Okay.
All the developmental milestones are range. Okay, so here what we are saying, what we usually see, what we usually take these months, these are the median months. है ना? Range earliest, yes, they can start very early in some children, but then the specific months that we mentioned, they are the median months where the maximum population would achieve that milestone.
Okay, sir.
You can see around that girls like even 9 months, 10 months, 1 year old, they can say sentences. You can observe that. All right. It doesn't mean that a child can start saying 2 to 3, 4 words by the age of 9 months, right? It is the median age that most of the population children starts developing this milestone at this age. All right, earliest it can be started at any age, and at the late age, beyond that age, if it has not started, then it is delayed. All right, so we are talking about the median age. Median age at most of the population starts developing that milestone. All right, so you are also right, but we are describing here that what it is mentioned in your standard textbook. All right, so babbling is mentioned 6 months, cooing 4 months, 3 to 4 months, right?
Yes.
Okay.
Sir, is it better to follow developmental milestone references from Ghai or Nielsen for the purpose of this quiz and in general also?
For you, undergraduate, you follow your OP Ghai standard textbook, right? Dr. Piyush Gupta's book and OP Ghai. And there is IAP PG quiz also. For postgraduate students, we recommend studying from Nelson. All right. So don't waste your time in studying, going through the Nelson. You just follow your standard textbooks and go through the recent developments if you can, right? New IAP guidelines on their website,
Okay, sir. Thank
things, right? Okay. You all of you focus more on immunization, recent trends, COVID, then anthropometry and nutrition. All right. You focus on more on these things. All right. Okay. So after this round, out of the 12 students who appeared in this screening test, we will be selecting top 8 candidates, and with these top 8 students, we are organizing our next round. That will be main IAP undergraduate quiz, and we may, Surinder, how many days we may need to declare the result? Maybe by Monday, right?
Yes, sir.
By Monday we will tell you on this group only, WhatsApp group only, and Surinder, I think before that they themselves will declare the result, I think.
Yes, sir. They know all the answers. Yes.
So okay, so on Monday we will declare the result and we'll tell you that when we will be conducting the main quiz date. All right, so we can end now.
Yes. Sure. Thank you, everyone.